Welcome to another episode of DEVTALK. When you're feeling down or you don't feel like yourself,
There are times when doing research on the internet and matching what you feel with the symptoms listed down there is not the same as having a professional do a diagnosis.
but this is what society makes you believe.
Stigma with mental health in the Philippines.
Personal counseling and treatment do not come cheap, so many Filipinos think twice before getting a doctor's opinion on their mental health condition. They either self diagnose or assume that they're just going to get through what they think is a rough patch.
The cost of counseling and treatment is not the only factor that sets back most Filipinos from going to doctors to get a professional opinion. Filipino culture encourages coping through social means.
This kind of thinking usually leads to Filipinos with mental health problems who experience substantial discrimination, which is severe to the degree that it threatens the financial survival of the entire family. Culture-bound beliefs and social structure, like perceiving mental health problems as familial problems, traditional communal unity, play important roles in shaping and modifying stigma experiences.
People with mental health problems experience psychological abuse, such as being verbally insulted, laughed at, stared at, gossiped about, along with physical violence, being restricted, not being supported, being taken advantage of, being neglected, and being rejected.
Families are an important source of stigma in terms of prominence, as stigma from families are often repetitive and prolonged.
People with mental health problems also experience stigma, frequently from their neighbors, and sometimes from school, friends, co-workers, and employers.
Occurrence of schizophrenia in the Philippines.
Actually, in the Philippines, according to the latest report from Johnson & Johnson's Philippine Health Information System on mental health conditions, with data gathered from 10 government hospitals and 4 private hospitals, schizophrenia is the top brain disorder in the Philippines, affecting at least 42% of patients who seek psychological consult.
To relate, that is roughly 4 in every 10 people who are diagnosed with schizophrenia.
In the Philippines, access to mental health facilities and institutions remain uneven throughout the country. Most of the facilities are situated within the National Capital Region and the country's major cities, which makes accessibility a challenge for those who live far from these areas.
Moreover, the Philippines has only one psychiatrist for every 250,000 mentally ill patients, far from the ideal ratio of 1 to 50,000 patients. In fact, suicide is the leading cause of premature death among the schizophrenic population.
What is schizophrenia?
The word schizophrenia came from this Greek word, which means to split, and this Greek word, which means mind. Basically, it means to split the mind.
Schizophrenia is a chronic and severe mental disorder that affects a person's perception of reality. It is a long-term mental disorder involving a breakdown in the relation between thought, emotion, and behavior, leading to faulty perception, inappropriate actions and feelings, withdrawal from reality, and personal relationships into fantasy and delusion, and a sense of mental fragmentation.
This manifests in their behavior and general attitude, including instances of hallucinations, delusions, difficulties in focusing, and the like. Many who have it experience difficulty forming relationships and succeeding in school or at work.
Individuals may have psychotic episodes when they break with reality completely and show drastic behavior or personality changes to the shock of those around.
While there is a lot of variation, people who develop signs earlier will usually have a more serious form of the condition. The average age that the signs appears somewhat by gender.
Most men experience symptoms between their later teenage years and early 20s, while a majority of women show signs in their early 20s to late 30s. It is uncommon for someone to be diagnosed who is much younger or older than this age.
Many will go through a prodromal period where the condition has begun before it is fully developed. This can last as little as days or as long as years, and due to its subtlety, is hard to notice.
It generally involves some struggle with friends and academics, as well as challenges with sleep, focus, and mood. Many will isolate themselves or withdraw from those around them as they experience strange thoughts and fears. Over time, the condition will grow worse.
How does poverty affect those with schizophrenia?
Getting at Ayano of Emmanuel Mental Specialized Hospital in Ethiopia reported in the Journal of Schizophrenia Research last year that psychosocial and economic factors can trigger schizophrenia development among those who are vulnerable genetically.
For instance, economic factors such as poverty can trigger schizophrenia development in children when mothers experience prenatal stressors and malnourishment during their pregnancy, especially during their first 2 trimesters.
Another factor is viral infection, particularly for children of mothers with viral infection during pregnancy. Heavy marijuana use is also a trigger factor among teenagers.
How does schizophrenia affect poverty?
Lost social roles and opportunities due to stigma surrounding mental illnesses, increased financial strain, which negatively affect families as well as people with mental health problems themselves. The effect is exacerbated when people with mental health problems and their families live in communities where many people find it difficult to make a living.
The cost of transportation to medical facilities and treatment fees put them in a further difficult situation economically. In such conditions, entire families often suffered from the financial strain that was due to stigma to the degree that they could not afford basic items, including food and clothing.
How can we address the problem of schizophrenia?
The World Health Organization said that there are effective strategies to prevent mental disorders and several ways to alleviate the suffering caused by them. In this matter, access to healthcare and social services capable of providing treatment and social support is the key. However, access to healthcare facilities and an adequate number of skilled human resources for mental health remain as the main barriers in providing treatment and care, especially in low income and middle income countries.
Implementation of the Mental Health Act.
To overcome this, the Mental Health Act must be efficiently implemented. The Mental Health Act, or Republic Act number 11036, aims to establish a national mental health policy directed towards improving the health of population in schools, workplaces, and communities, underscoring the basic right of all Filipinos to mental health.
It also highlights the balanced delivery of mental health services, community-based and hospital-based, with more focus on persons with psychiatric, neurologic, and psychosocial health needs, and overcoming society's attitudinal challenges that they may live free from stigma and discrimination. The local government units shall provide community and recovery-based approaches and the delivery of culturally appropriate mental health care services, including the development of guidelines in coordination with the Department of Health to ensure the provision of community-based mental health services. We should be open to the idea that hallucinations aren't just a result of hunger or a lack of sleep. These aren't the only things we should be open about, though.
Whenever a friend reaches out to you, don't brush them aside. And when you feel the world closing in on you, don't keep it to yourself. People are always willing to lend an ear.
If someone you know needs help, encourage them to talk to a professional. If you need help, don't hesitate to turn to a professional as well. Get in touch through these numbers. And that concludes this episode of DEVTALK.
Watch out for more episodes.